Now, we spent a bulk of our time trying to look at cancers that actually originate from the blood, all right, which we made a lot of progress, right? Spoke about leukemia, spoke about plasma cell dyscrasias, a lot of them, right? So now we want to look at another category of cancers, and this one is known as what? The non-hematological malignancies. That's cancers from any part of the body once it is not originating from the blood. Do you understand? So this is trying to classify cancers based on if they originate from blood or if they don't. Okay, so it's as easy as that. So there are just cancers that originate outside the blood and bone marrow. So typically they occur in all those other solid organs that we have around the body. So they originate from solid organs or tissues, okay, and we'll classify them, okay, based on the types and the organs you can find them in. So examples, we have carcinomas, okay, the ones from the epithelial cells like breast cancer, okay, from the lung, from the prostate, from the colon, okay. These ones are blood cancers. I brought the image here so that you know the difference between what we are talking about. So we're talking about cancers that are not blood, alright? We have sarcomas. This one's cancers of connective tissues like bone, muscle, fat, you know. We have melanomas. Those ones, they are color issues, you know, from the skin. Neuroendocrine tumors. Then we have the central nervous system tumors. Then, so based on types, we have breast cancer, we have lung cancer, we have colorectal cancer, prostate cancer, pancreatic cancer, ovarian cancer, skin cancer, brain tumors. Of course, the organ where you find them in, you usually see the name of the organ before they put cancer, right? So most of these cancers, you pick them up by imaging, then taking up some tissues to kind of like send it, okay, up for biopsy. So most of them, they occur in a solid way. So if you want to treat them, you can just cut out the tumors or cut out the organ. Okay, if you can cut out part of the organ. They use radiation therapy, use chemotherapy. Radiation therapy is radio waves, while chemotherapy you are using all those drugs. Okay, there's some targeted drugs that can attack these cancers, okay, along the cell cycle. Okay, the immunotherapy, where you are basically giving some 1 or 2 drugs to boost the immune system.